am Dr. Sherian Brown with FITSontheGO, and I'm here with Dr. Clyde Yancy. Dr. Yancy, welcome again to TRUE-AHF FITSontheGO.
Always delighted to work with the fellows, and FITSontheGO is such a cool program.
And we're so glad that the ACC sends us here to be able to do this, to talk with you and others. Dr. Yancy, tell us a little bit about your thoughts on the trial that you were moderating. Tell us about TRUE-AHF.
You know, the American Heart Association Scientific Sessions is just a great venue for the release of new and informative data. And I wanted to emphasize the word informative because I think that in the interpretation of the TRUE-AHF trial, we have to keep that in consideration. So this is yet another trial for acute decompensated heart failure. At this point in time, I expect all the fellows to know that we are still looking for a definitive intervention for acute decompensated heart failure. We know that process improvement works, but no single agent, be it diuretics, vasodilators, certainly not inotropes, has been proven to change the natural history of a very important inflection point for patients with heart failure, meaning that their subsequent outcomes are much more problematic. So this was a test of a very novel synthetic natriuretic peptide that's based on the physiologic action of urodylantin. What's important about this natriuretic peptide is that it's upregulated based on the distal delivery of sodium to the convoluted tubule in the kidney. So that's in keeping with what we think is happening in heart failure with more sodium load in the intravascular space, and concomitantly, it's a vasodilator. So theoretically, it should have provided relief of symptoms. What's remarkable is that concomitantly, it tested the hypothesis of whether or not early intervention, not within 48 hours, within 24 hours, or within 12 hours would work, all of which had been looked at before, now within 6 hours. They accomplished getting therapy done in 6 hours, but ultimately showed no benefit on the pre-specified endpoints. Now pause. What does all this mean? We should still use vasodilators to alleviate symptoms, but we need to be very clear that the use of the vasodilator doesn't change the natural history. We should also recognize that natriuretic peptides are available and can serve in that function. But we have to also appreciate that this is a very challenging disease, many different types of acute decompensated heart failure, different kinds of patients, a natural history that's very concerning. So we still have to look for that elusive trigger that determines when people go into the disease. Even though this was early intervention, time zero is when a patient hit the hospital. Quite frankly, decompensation happens days to weeks ahead of time, so it could be that the injury phenomenon is too late. But in this experiment, targeting an elevated NT-proBNP and proving that you could change it didn't improve outcomes. So lots more work to do and a lot more questions to answer.
Thank you, Dr. Yancy. And congratulations on your induction into the National Academy of Medicine.
You're very kind. Thank you. I appreciate that. And for all the fellows that have supported me over the years, thanks to them as well.
Thank you. We appreciate learning from you.
Thanks so much.